Assalamualaikum, very good morning and hi class. Welcome to Healthcare Information System subject. Uh, I hope you are in a good health. Today we will discuss on the chapter 7, Communication System in Healthcare. So this chapter is actually to discuss about what is the communication system basic, and then communication technology used in healthcare, and then we discuss the relationship between clinical communication and telemedicine. So we hope that after this chapter you will learn, or you will be able to define the communication uh, system, and also the communication technology uh, would be involved in the healthcare processes in certain healthcare organizations. Yeah. So as you know that communication is very important, and good interpersonal communication is also essential skill for any healthcare worker. So the communication cannot be run away from uh, or between people to people, especially when you involve in a specific business. Yeah. So communication is not only happen in the healthcare industry, but communication is also happen in all field, in all business that involve people. Yeah. We take one example in education industry, for example. So uh, you are in the education field. Yeah. So you as a student, so in education system we have student, we have lecturer, we have administrator, uh, workers. Yeah. So when you want to deal with the administrator, when you want to deal with the lecturer, you need to communicate to them. So their communication term, yeah, their communication style, of course they have their own uh, terminology used. For example, you will talk about you and lecturer and administrator will talk about the student registration, for example, uh, student fees, for example. So you talk about the CGPA, you talk about GPA, you talk about midterm, you talk about uh, teaching and learning, you talk about lab, you talk about midterm examination, you talk about final examination. So this is a communication term that you use in the education field, in education uh, industry. Okay. Another example, when you go to another industry, for example, in banking industry. So when you deal with the bankers, you will talk about you, and they will talk about specific term relate to their industry. Yeah. For example, what type of account you have? Is it current account, saving account? You want to clear your check? You got problem with your credit card? You got problem with a debit card? How about your ATM machine card? Yeah. And then maybe you lost, or your account is scammed by scammers, and then you want to uh, make a loan, personal loan, housing loan, car loan. Yeah. So this is a term that you use in banking system. So it's refer to a specific industry kind of business. Yeah. So I give you example, already give you example, education industry, banking industry. So you when you go to oil and gas industry, of course they have their term and how they communicate, use the term. Yeah. So we can get another example, but the two example is very clear to give you an overview that why the communication is very important in healthcare industry. Yeah. So effective communication, whatever industry, yeah, is central to smooth running of the business. So effective communication is central to smooth running of healthcare system as a whole. So in healthcare system industry, so it cannot run away from the example that I given to you in banking and also the education. So healthcare system have their own communication and terminology that use. Okay, so the care of patient involve many different individuals, in part due to increasing specialization within the profession. So when we talk in the healthcare industry, there are many department, yeah, services involved. For example, uh, when you arrive in the hospital, so you will communicate with the registrar clerk, yeah, to register your visit for the day, and then they will pass you to specific department or services to get the right treatments. Yeah? Let's say you got heart problem, so they will send you to the cardiology department, or you got a problem with your children, so they will send you to the pediatric department, or you got eye problems, and then they will send you to uh, what do you call it, uh, eye department, they will call it um, I forgot why I cannot remember. Okay, so let's say you got problem with let's say for the pregnant woman, so they will send to ONG, for example, yeah, obstetric and gynecology. So there are many specialization, and there are many department involved in certain or in one uh, healthcare organization according to their size. Yeah? So in Malaysia, we got system, healthcare system. So they start with the primary care, and then after primary care, you go to the uh, secondary care. They call it district hospital, and then after district hospital, they go to the tertiary care. Yeah. Specialization of hospital, like Hospital Pandan, Hospital Sedang, okay. And then after that, you go to the specialized or uh, center of or research center for specific disease. Yeah, for example, Central of Heart, yeah, IJN in Kuala Lumpur. Right? So we got ophthalmology center in PJ, for example. Okay, we got uh, what do you call it, cancer center in Putrajaya, for example. Okay, so this the many different services and department require a very good, very effective communication. Yeah. So while you are in the hospital, you will see that the health worker will use a term, and their communication term we relate to their we relate to your episode, for example, visit, for example. So they use this healthcare term. Yeah, they will talk about uh, referral, appointment. You will talk about the pharmacy or your medication, about your disease. Yeah. So when you go to cardiology department, so they will talk about cardiology specific tests, for example, echo test, yeah, stress test. Yeah. And then when you got a blockage in your heart, so you will go to a uh, operation, a specific procedure. For example, angioplasty, yeah, uh, open surgery, yeah, bypass, yeah, and then another problem of heart is what they call it, I don't remember, is related to children's uh, diseases on their heart. Yeah. For example, the valve of the valve problem of the heart. Yeah. So they will talk about this term. And this is a communication in healthcare. So when you go around in the hospital or healthcare center, so you will see a lot of communication type. Yeah, either poster, either code, and so on. So in that case, it is an important to consider the application of communication technology to healthcare, such above scenario or such a example that I given to you. So uh, for a non-IT hospital, normally they will use a manual communication system. Yeah. Not to say that when I talk about system, is system computer. System is a systematic process uh, involved in certain business process. So when we have established one organization, they have established system in their organization. After that, you can actually computerize the system. So we call it a computerization system. Okay. So this is some introduction. Yeah, why the communication in healthcare is very essential and very important to be understand, to be understood by the developer, so that so the developer, software developer or software engineer, easy to understand what is the requirement of healthcare information system. So how they want to computerize, yeah, the healthcare information system is through the understanding about the communication involved in the healthcare system. Yeah. So without you understand the healthcare system for certain organization, so I think you will get you will got stuck in the middle, and then maybe you will produce a wrong system for healthcare provider. So this is one of the trigger. Your system will be fail, or you cannot fulfill the requirement of the health information system that expected by the healthcare provider. Okay, this is a communication system in hospital. Communication is the ability to send and receive message. So why you communicate? Because you want to send a message, and then when you send a message to someone, so you expect reply from them. So when you communicate with the nurse, for example, so they will reply to you. So when you communicate with the doctor, so they will reply your question. So this is a communication. So communication mean people to people, maybe people to machine, machine to people, machine to machine. Okay, machine to people to machine. For example, you do self registration, so you communicate with the system, with the computer. So machine to people, for example, you got notification for appointment. Yeah. Oh, message will send to you or notification will send to you saying that you will get your appointment is coming in 2 days, for example, another 2 days. So the machine remind you, the machine notify you. Okay. So machine to machine, meaning to say that when the hospital or any business process is computerized. Yeah. So when you submit the transaction, for example, the doctor clock in the clinical finding for the patient. So the machine will capture the data and then will send to the database, and the database will receive the information and save into the uh, machine. So that means we computerize the transaction or the business process, and then let the computer do uh, the rest of the task. So when you look at this one, this is the number of possible conversation between nurse and GP, GP and physician, physician to patient, patient to laboratory, yeah, patient to physician, and etc. Yeah. So this is a communication involved in healthcare system, in hospital. Okay, communication system is in a hospital involve a message. For example, inform newspapers, TV newscasts, educate, education. Yeah. Uh, in term of tax, when you go to the hospital, you will see the sign. Yeah. The poster regarding on how to control diabetic, how to manage the hypertension, and so on. And this is very easy understand through the poster. So we will discuss on the poster later. So education is about the information to the patient. So the education or regarding on healthcare information can be disseminated through text. Text mean through the message you will get from the WhatsApp, for example. Video, yeah. Maybe you will see ADS, through YouTube or through TV. uh, Astro, so they will stop the movie and then they will blast the education information. Nowadays a lot of education about the social distance, yeah, regarding COVID-19. Yeah. So they will teach you how to uh, wearing the mask, how to get distance social, yeah, uh, how to know that you uh, affected by the COVID-19 virus, what is the factor, and so on. Yeah. So this can be disseminated through DVDs and also the internet. So messages are intended to persuade. Yeah. So this I told you the advertising regarding on, let's say, supplement. Yeah. So you take supplement ABC. So this is good uh, for control your diabetic. Yeah. So and this also uh, you can have in the hospital when you wait for your queue in the registration before you will call for consultation with the doctor. So you will see the big screen. Yeah. The left side is your queue number, and the right side is the advertising. So they will blast the uh, video, short video. So nowadays there are a lot of advertising use the short video. Yeah. And then the message is intended to control machine and tools such as computer. So the communication system in hospital, uh, they use a message to control a machine and tools such as computer. Yeah. So sometimes you see some the air condition in the ward, for example, they use control a message, a text, or use apps, mobile apps to control the temperature of the uh, specific room in the ward. Yeah. So the nurse, for example, they will send a message to the computer to control the temperature of the ward. Yeah. So communication may be verbal and non-verbal. Yeah. So we see what is a verbal and what is a non-verbal. So before a health worker perform any medical procedure or care task with the patient, it is important that they use verbal communication to inform the patient. This allow the patient to know what to expect. Yeah. What example? Uh, when you are admitted into the ward, so the nurse will be the nurse will give you an explanation what is what you need to do and what you need not to do. Yeah. Do and don'ts. Yeah. When you are in a ward, so you have to obey with the rule. Yeah. 9 o'clock you have to go to sleep. So no walking there, walking here. Yeah. Visit a friend in the ward. You got chatting here, you got chatting there. No. So you have to almost the time you must in your bed. Yeah. So this is a rule. So this is done normally verbally uh, by the nurse in the ward. And every day, 8 o'clock a.m. So the doctor will go around the ward, visit the patient, and then the doctor will ask you about your condition. So they will give you advice, give you explanation about your diseases, okay, what next, and then whether your status of diseases is moderate or severe or normal, and so on. So this is done normally verbal. So verbal communication can also be used by the patient to inform the health worker how they are feeling, what concern they have, and any other question the patient may have. Yeah. So not only done the communication, verbal communication is done by one side, yeah, one side from the health worker, but you also can communicate verbally to the uh, health worker, a nurse or the doctor, regarding your health status. So maybe you can inform the doctor that last night you got very headache pain. Yeah. You got pain in chest, for example. Yeah. Very fatigue. Yeah. You got stomach problem. You got sneezing. Yeah. Swelling in your leg. You got cramp uh, in your leg. Yeah. So this is a verbal communication. So this is a communication done throughout your admission. Yeah. So there are and there are many communication can be done in the hospital uh, services. For example, when you go to laboratory, so you need to communicate with the laboratory, and laboratory uh, will verbally ask you to take the specimen, for example. Okay, so you take this bottle, for example, and then they will ask you to go to uh, toilet to check to take the urine. Yeah, so this is a verbal communication. So when you go to radiology, so they will uh, the radiologist will ask you to open your uh, shirt. Yeah, so they will ask you to take deep breath, and then they will take the picture of your chest, for example. So non-verbal communication in the healthcare setting come from eyes, hands, and other part of the body, providing eye contact and not crossing the arm and leaning in when talking to a patient are non-verbal ways to communicate you are. So what does it mean? Verbal communication means um, so from your body language, yeah, for example. So this is a body language. So this is non-verbal communication. So the doctor understand when they knock to your ankle, for example. So your ankle will move uh, left or right. So this is a non-verbal communication. So they know that from your physical movement. So this will trigger some problem or trigger or get the sign that you got problems, and then the doctor understand your pain, for example. Yeah? So when they push your stomach, then you will feel something, yeah? And then this is a sign that means something inside your stomach. Yeah, so this is a non-verbal, meaning this is done through the physical examination, yeah, normally physical examination. So the doctor will open your eyes and then they put the torchlight, yeah, for example, they will see your ear, yeah, they will see your tongue. Okay, okay, so this is a non-verbal communication. But this is if you study the medical science, so this is a training the medical science people will go through. So communication involve formal and informal. Formal communication is often found in hospital policies and document. So you will see uh, the rule and regulation, term and condition. So this is a formal. So they will put in the wall. For example, when you go to hospital, you will see a lot of formal instruction, formal procedure, formal warning, and so on. Okay, so this type of communication can very rigid, leaving little or no room for feedback and deviation. So whether you like or dislike, so you need to follow. So informal communication is less structured and often allow for more interaction and communication between patient and caregivers. So conversing with patients about their interests, families, and daily activities generally occurs using informal communication. Yeah. So this is normally informal communication is less structured. For example, uh, what is the best example to give you? When you got the medication, your medication, so you will see the in the plastic of the plastic cover for your drug. So they will instruct you uh, take this drug before or after a meal, right? So that is a formal, but sometimes it consider informal. Yeah, when the uh, pharmacy they want to dispense the drugs, so they will give a what they call it instruction, yeah, or counseling, medication counseling. So they will ask you, okay, Kanapi takes this drug 3 times per day, and if you feel that something you got allergy, so please stop. Okay, so this is informal communication, less structured. Although it put the sticker, the instruction how to consume the drug, so the pharmacy will communicate to you and advise you what to do when you got something wrong when you consume this or that uh, medication. So communication is aided by the technology. Nowadays, a lot of communication is done through internet, or we call it IoT, Internet of Things. So the machine will communicate to the people through the intelligence software. Yeah? So the machine will learn with the information given to it, and then it will process and trigger the people what to do, remind the people what is the appointment, uh, next appointment, who will you see today, what kind, what type of breakfast that you should take when the system trigger that your blood sugar is high. Okay, maybe machine will communicate to you saying that your blood pressure today is not good, it's not normal, it's very high, and then they will ask you to take a rest, yeah, to low down the the blood pressure of the people. So in these instances, many use technology aided communication device to hear or speak. Yeah? So very clear, very simple example. When you go to the hospital, so you will got the token number, right? So this is a technology. Yeah? So when you press the button and then you will get the number. So that is a technology, how to communicate with the numbering system, how to communicate with the provider. Yeah. So if they don't have a queue system or calling system, so there is no system in the registration department, in the front end counter, right? Everybody will try to get the first number, so it'll become haywire in the front end counter. Yeah, so during my age, yeah, my early age, so there is no very difficult, we can find the uh, automatic or computerized calling system or numbering system, so we have to queue manually. Yeah, some of the unethic people will go to shortcut, they will bypass you, so it become chaos, chaos in the front end counter. So many examples we can see, patients who are unable to speak may type their thought into a computer that announce them out loud. Yeah. So this is very look simple, yeah, numbering system or calling system, but it have a lot. Yeah. So when you take a number, you got the token number, and then you wait in the waiting chair, right? And then you can do other things, so you can browse your Facebook, your Instagram, and then while waiting the number to be called. Yeah. So suddenly your name or your number is calling. Yeah. And then you will be trigger, Muhammad Kanapi Abdul Ghani, go to room 4, for example. Yeah. So you don't need to follow up to the counter, what is your next number, what is the next number. So you just wait and then waiting for the sound. Yeah. So communication need technology to mitigate the problems. Yeah. So another communication in hospital, so they use sign and symbol, not only in the hospital, when you go anywhere, when you are in highway for example, so you will see the sign, exit to Malacca, exit to Aikro. So you will reach the Alur Gajah in 10 kilometer, for example. So this is sign. So same in the healthcare industry. So they will put a sign. For example, to check your pain scale, your pain scale, 0 to 10. So they put a picture so that you easy to uh, measure how severe, how worse your pain. Yeah, looking at the emoji picture, so you will easily to define that which number that you are, which part of the pain that you are now. Okay, so this is a sign and symbol. So by using the sign and symbol is very easy to understand. Although you are not going to school, yeah, so you understand, oh, this is a happy emoji, so this is a smile emoji, so this is a worse emoji, and so on. Okay, so using this type of communication is beneficial in care setting, as it allow individual who are unable to read or understand a specific language uh, still know what is being communicated. So let's say the patient handle OKU, disability patient, so they cannot communicate. So sometimes it accompanied by his or her mother, right, or relative. So the relative will explain. But sometimes when you when you use the third party people to explain what is your problem, so sometimes it's miscommunication. So sometimes doctor communicate directly to the patient. So uh, the disability patient uh, can be use a sign or symbol to express their problem, so that it easy for the doctor to digest what is the actually problem of this patient, of that patient. Okay, so you can see that the communication is very important in healthcare, especially for the doctor to capture the patient problem, and from the information and sign or feedback given by the patient to the doctor. This is help a lot, for the doctor to provide the right medication and the right treatment for the patient. So when you communicate wrongly, so of course the outcome of the treatment and then the medication will be slightly wrong or totally wrong. So this will danger the patient. Maybe the patient will get a wrong medication, and they will die. It's not because of their diseases, is because of the wrong prescription of the drug. So this is happen in developed country. In US, a lot of wrong prescription dying the patient. Yeah. So sign and symbol, this is a type of communication. So a telephone system. So this is a common, yeah. So telephone means communication, yeah? uh, technology, so among the different staff members and also with the patient. So I always uh, got a call phone from the hospital, yeah, from the hospital Sedang, saying that the appointment is deferred regarding on the COVID-19 uh, case increase in hospital Sedang. So the patient are not safe to come to the hospital, so they will communicate, and blast the message to the patient that involved in any appointment date to the hospital Sedang. So this is a very effective communication technology. So I think I don't need to explain about the telephone benefit and usage. Yeah. So another communication type is application system. So application system is a practical application include greater accessibility and speed of communication. Yeah, patient safety and triage capability, ease of management, is very flexibility, tackling day-to-day problem. So this is a role of healthcare information system, which is wrote using a computer software. Yeah. So one a big and very good example and very beneficial to the healthcare industry is a healthcare information system or EMR system. Okay, through the EMR record the communication across the hospital, yeah, across the healthcare provider, uh, become uh, faster, yeah, seamless and borderless. Yeah, let's say that the radiology department is very quite far from the main building of the hospital, but through the system computer, the order system, uh, so the order can be sent to the radiology department. Or let's say the health center doesn't have uh, enough drug, for example, and then the patient will be asked to and the patient's medication will be ordered to another hospital, for example. So another hospital, the neighbor hospital will receive the order from A hospital, for example. So this uh, become seamless, yeah. You borderless, so you can send the drugs when the drug is not available in certain hospital. So you can get the drug for the patient especially, and this it will increase the healthcare services. So the application system is very beneficial to the healthcare industry. So that's why the healthcare information system is very important to be implement in all hospital or health center or clinic, yeah? To share the electronic medical record, which is very uh, viable information, very trust information, and the most important thing is the speed. Yeah? So when you got problem uh, from the EMR, we can see the history of medical record of the patient. So doctor can easily to predict, yeah, the certain problem of patient, certain problem of diseases. Okay. Okay, so this slide I think redundant. Okay, another communication is signage system. So this is one of the communication. So when you enter the hospital, there are many signage uh, put in the left, in the side, in the main door of the hospital. So they will give you navigation. Yeah? Cardiac care, for example. So left side is the pharmacy, satellite pharmacy. So toilet, prayer room, yeah? Exit door, patient room. Okay, so this is a signage system. So this is a communication type in healthcare. Yeah, but you can find that the signage system is not only in the healthcare industry, but when you go to the uh, banks, or you got the banking matters. So you will see that, okay, so this is a counter for fixed deposit. So this is a counter for Amanah Saham National Berhad. So this is counter for uh, high purchase loan and so on. But in banking is very small signage. But when you go to hospital, there are many department and services. So if the hospital doesn't have or show the signage system, so I think the patient or the visitor will got lost in the building. Yeah, because there are many ward. For example, when you go to Kuala Lumpur hospital, it's very big hospital. So when you go to Johor Bahru Hospital, Sultan Aminah Hospital, it's very big. Yeah. Uh, uh, just uh, yeah, just to test. So you can make a visit to the Hospital Melaka, for example. So how big Hospital Melaka? Yeah. Try to go around all bidding in the Hospital Melaka and try to find, for example, pediatric ward. So how you find it? Yeah. Without sign age, for example. So you don't see the sign age, you try to find the pediatric ward. Yep, try to find. So you cannot find it. Right. So this is a communication system. So they use a sign age system. This sign age system is a manual, right? Manual means no computer use. So you can use a computer. For example, you put a kiosk in the front of the uh, front door, right? The main what they call it, uh, lobby, lobby of hospital. So normally they put the kiosk. So so from the kiosk you can select where you want to. You can search the map where you want to go. So let's say you want to go to cardiology department, so you press the cardiology, so they will show you the maps. Yeah, so this is electronic signage lah. But I think not all signage can be practically used by system, computer system. Yeah, so it's very, what they call it, it's not conducive to browse the computer, yeah, compared to the signage board in the in certain driveway or in walkway in the hospital. Okay, very easy. Okay, another communication. So this is integrated service digital network. So ISDN is international communication standard for sending voice, video, and data. So this is a example of communication technology that we use nowadays. So ISDN, or now we call it wireless WAN, wireless, what else? Internet. Yeah. So this is a latest technology for communication. So we communicate with people through internet. And we call it internet. It involve www something. Yeah. So this is uh, the good thing in the computer. Yeah. In uh, network technology. So when internet comes, so there are a lot of things that can be computerized. Yeah. So you can communicate to people around the world, yeah, through email, for example, through WhatsApp, through Facebook Messenger, yeah, through Instagram. So what you do right now, you can share to the world. Yeah. Let's say you go toilet, so you also say in your Facebook, I want to go to toilet. Yeah. So everything uh, is checked in by the uh, netizen. Yeah, netizen will inform the world what they do. So sometimes this is not good. We need a research, whether this is also diseases or or what we call it. Yeah. So it become addicted. When you see the very famous influencer in Malaysia, Nilofa, wherever she go, she will record her activity. Yeah. And so this become angry by the netizen, because uh, she can cross the border during the COVID-19 MCO. Yeah. So so I think Nilofa got uh, one of the diseases. They call it uh, insta. I call it insta addicted. So this is not good actually. So uh, we need to balance, between technology and also the private life of us. Yeah? So this is a very ISDN. uh, there are a lot of type of network nowadays, IPv6 and IPv5, 5G, 6G now. So this is the beginning of the network technology. We start with the modem, for example, last time when we want to uh, got the internet communication network, we have to dial up into the ISDN line. Yeah. So we use modem during that time. So the line is very slow. Yeah. So nowadays uh, the bandwidth of internet is very huge. So you just press the button and then you will get into the internet. Okay. So internet give I think give a lot of benefit, right, to the lot of industry, for example, especially on the healthcare. So last time in 2001, so the network bandwidth in Malaysia is not so good, and the internet provider also charge the line is quite expensive. So compared to today, the line is improved, and then a lot of application can be applied into the web-based application. Yeah. We can transfer the image easily. We can transfer the voice. We can use video teleconference with the doctor and patient. Last time it's very difficult to get a video call. Yeah. So we don't have WhatsApp. We don't have Messenger. Yeah. And then what we have ISDN typical line only. Okay, clinical communication and telemedicine. Telemedicine are the application and development of the telecommunication network, where health expert can solve problem by using the electronic and communication technologies without distant limitation. So this is a communication technology in healthcare through uh, telecommunication media. So telemedicine means medicine at distance. Yeah, let's say I live in Johor, Tangkar, so I can talk to doctor in Kuala Lumpur, for example. So I can choose uh, a preferred doctor that relate to my disease, for example, and then I can talk to the doctor through video conference. Okay, so this is kind of telemedicine. Yeah. So telemedicine not only cater for consultation, but they can also cater for education, for example. So you can see in this picture. So the consultant, for example, a senior specialist will give a lecture to the junior doctor. So, so telemedicine not only provide the medicine, but the scope is high. Consists of clinical consultation, education, information, and what else? Alert, yeah, and also the notification. Okay, notification and alert is same thing. Yeah. So so there are a lot of provider provide the medicine, telemedicine, uh, but the telemedicine provided by the current provider, especially for example in Indonesia, they call it HelloDoc. Yeah, HelloDoc. You can find the doctor and then you can communicate with the doctor. What is your problem? So the process is same. When you meet the doctor in physical, face to face. So the difference is you use technology, and another one is you don't use a technology. So you physical, one is a physical consultation, and another one is a uh, with not virtual. They call it consultation at distance through communication technology. Okay, I don't touch more on the telemedicine. So this is consider one subject. Yeah. So this actually telemedicine is my PhD actually. So uh, we we cannot finish in 1 hour, 2 hours to talk about the telemedicine and also the telehealth. Yeah? So this is a way of telemedicine is one of the communication. Yeah, uh, in clinical what they call it in clinical in manage the clinical process, and also another process of providing healthcare services to the patient through uh, network telecommunication. Yeah? So another communication in hospital is a PA system. Okay, you I think you got experience in the hospital. So some of the hospital using PA system. So they will call the patient name to go to the certain room. Yeah. Karam Shah, go to lab 1 to take your sample of blood. And then they will call another patient. Ainul, go to room 1, Dr. Hamsah, for example. They use PA system. So I gone through this communication system in the hospital. So a lot of hospital still use this PA system. So how you want to computerize the system in the hospital? So this is a innovation that require from the software engineer. Yeah. How to computerize the PA system into AI system. Yeah. So for example, when the patient arrive in the hospital, so and then the patient will ask to swipe their card, and then their visit is recorded, and when their turn is come, and the computer will read their name automatically like a robot. Yeah. So this can be replace the PA system rather than we ask the one nurse or staff just to call the patient. So it's better that we put a robot to call the patient, yeah, to manage this kind of I think unproductive work. Yeah. Okay, television. So this is a communication technology we can see in the hospital. So you can see that a lot of waiting at the waiting space in the hospital. They will provide the television, to give entertainment to the patient. So to make the patient happy and reduce their stress. So some people say that when they go to the hospital, their hypertensions become worse, yeah, because the waiting time is so long. Okay, same as me when I visit the hospital Sedang. So at the moment I enter the hospital, so my blood pressure is increased because a lot of car, no parking. The parking is very far from the hospital, so you have to walk sometime a half kilometer. Yeah. So you need to get a bus to come to the main building, uh, because your parking is very far. Try to visit the hospital Sedang one day, so you will get the experience. Or you go to the hospital Selayang, how difficult to get the parking lot. Yeah. So you will need to around the hospital, I think more than 5 times, and then you will get the parking at last, at last, but very far from the building. So television is one of the communication entertainment. Yeah. So some of the hospital VIP ward, they will provide the LED screen, LED TV for the patient to watch the news, the movie. So this will make a patient release from their pain. Yeah. Or maybe another way is for uh, there are many ways to release the pain. Not only watch the TV, but in Islamic way. So we provide radio or cassette regarding zikr, yeah, zikr to Allah SWT. Yeah. So maybe they provide a channel, special channel for Muslim, for Buddhist, or for Christian. Yeah. So so this is a television function in hospital. So another function uh, away from the ward is the in the calling system. Yeah. So they provide a TV. Uh, in Malaysia, we have Ministry of Health provide their own TV. Yeah. They call it Medic TV. So the Medic TV will provide information about health related matters. Yeah. So how you want to go to gymnasium, how you start to stop the smoking. Yeah. So they have a, medic TV program for certain program, yeah, for certain diseases. Yeah. Smoking is a diseases also, or they call it a social problem. Yeah. Okay, CCTV. So also is a communication technology in a hospital. So we can use CCTV to video the civilians, to capture the unexpected problem. Sometimes to control the security breach, and provide valuable visual evidence that can be used to increase productivity and prevent dishonest claim. Yeah. CCTV will is required in the ward. Yeah. So sometimes criminal case also happen in the ward. Yeah. So through the CCTV we can control, we can uh, capture the moment, who involved in certain criminal. Okay. And then we can keep track the patient who run away from the ward. So there are many cases during this COVID-19. Yeah. Certain some of the COVID-19 patient run away from the center. Yeah. So from by using CCTV, we can capture their face, and then we can follow up later. Police can recognize them and take back them to the center again. Okay. So another communication is color code standardization: red, blue, orange, green, yellow, amber, black, white, brown, gray, pink. So there are a lot of meaning. Yeah. So this is understood by the health worker. Okay. Okay. Poster. So this is I told you before. So this is another uh, communication type. Yeah. For example, diabetic kills a person every 8 seconds due to high glucose in the blood. Yeah. Heart attack symptom, social distancing, coronavirus health and safety tips, the importance of mental health awareness. Okay. So hypertension, what is the our vessel look like, yeah, condition when we got hypertension, or we got pre-hypertension, or your vessel with a normal blood pressure. Okay. So you can see that when you got hypertension, your blood vessel is reduced. Yeah, reduced. It's very tight, look very tight. Yeah. This is very dangerous. It will make you stroke, or you got heart attack. So hypertension is very dangerous. Yeah. It's what they call it, a silent killer. Yeah. So you don't feel anything, because you don't know the status of your blood pressure. So that's why you need to get to buy the blood pressure machine. I think it's not expensive. 80 ringgit to 150 ringgit, you can get one machine. Yeah. Omron or other model. So you need to control your blood pressure, or let's say your mother or your father reach age of 50 or 40 above, so they need to control their blood pressure. So need to check every day, or every week. Need to check your blood pressure level. Okay. So this is a poster. Poster will attract the patient or people when they come to the hospital. There are many posters in the hospital, right? How to reduce the accident, yeah, for example, how to stop smoking, how to reduce diabetic problem. Yeah, there are a lot of poster. So from the poster is a very catchy, very catchy word they use, uh, that the audience can capture the information easily. Yeah. So that is a role of poster. Oh, summary now. So communication is a central point for effective healthcare services. So communication technologies in healthcare start from basic telephone to internet-based telecommunication, such as telemedicine. Now is m-health, it's mobile health, and teleconsultation. Yeah. So, and then television, CCTV, color code, posters, signage, PA system are the type of communication in healthcare business processes. So this type of communication uh, tools not only happen in the healthcare industry but happen in education industry, for example. But in education industry, I think you will get the comparison with the hospital. In the hospital, there are many poster, there are many signage involved. But when you go to compared to the university, I think it's very less, very less. Yeah, because very, I think it's not complex compared to the healthcare industry. So I think this is common when you go to hospital, certain hospital, this poster, color code, CCTV, television, PH system, yeah, signage. There are a lot of signage system in the hospital compared to uh, university or banks. Yeah, why? Why you see that there are a lot of poster signage in the hospital? Can you have a reason? Because the visitor or the patient to get the uh, treatment or to get to the uh, healthcare services compared to the university and bank, uh, it more huge population. So it involve population in hospital in healthcare industry. So because seeing the world is still there, so uh, there are lot of patient with problem uh, there uh, to get the healthcare services from the uh, healthcare provider. So the longer world still exists, so the longer people, the more people will visit the hospital. And nowadays, COVID-19 pandemics, so so the hospital become haywire now. When you see at the India, so the case is very huge per day, and there are a lot of people dying. Yeah. So hospital cannot afford to attain the patient. Yeah. Even the the supply of oxygen is not enough, when the doctor also give up, and the country become become haywire. Uh, when the when the when the disease happens without control. So we pray Malaysia will control this pandemic, and we hope that every citizen follow the MCO instruction, the SOP. Yeah, please wearing your mask, keep distance, don't go to the crowd place, stay at home, and make sure that you are in a clean and hygienic. Yeah, and then make sure that you aware how to manage when you got contact with the affected uh, people with the COVID-19. Okay, class. I think we should stop here, and then we will see you later. Thank you very much. Assalamualaikum and very good morning.